What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watched the video, maybe even liked and subscribed, I appreciate you. I really do. And welcome back. So today I want to talk to you about the treatment option and having surgery for your prostate cancer. I've been blessed with the opportunity to talk to some men who've been recently diagnosed with prostate cancer, and a number of men who have been on this prostate cancer journey. And there was a piece in here that it caused some confusion, and it caused me some confusion. And with that in mind, I was thinking maybe we're not the only ones that were confused about this. Now, before I get too far into this conversation, I am not a medical professional. I'm not here to give you medical advice. I'm only here to give you what my experience has been and to assist you in facilitating having a conversation with your doctor so that you end up with the treatment that you actually went in there to get. So let's talk about it. It's the difference between a prostatectomy, a radical prostatectomy, and a radical prostatectomy with nerve sparing. It's funny because sometimes when I heard people say that they had a prostatectomy, sometimes I just thought that they had just left the radical part off. But it's actually a different procedure. See, a prostatectomy itself is normally done for people who have BPH or an enlarged prostate. And it includes taking some of the tissue off of the prostate. I don't know how the surgery is fully done, but they leave the prostate in your body. And so it's called a prostatectomy. The thing that makes it radical, the radical piece of the prostatectomy, is they're actually removing the prostate out of your body. So one, prostatectomy, they're leaving it in. They're removing some tissue. The radical prostatectomy, they are removing the whole prostate from your body. And then there's the radical prostatectomy with nerve sparing. They're, again, removing the full prostate from your body, and then based on your cancer and your circumstances, they are sparing the nerve. And that sparing of the nerve is very important because that's what allows your erectile functions to come back. One of the things that I continue to say on the videos is that I chose the radical prostatectomy. I never talk about the nerve sparing piece. And that is important because the radical prostatectomy piece, they're removing the prostate out and they're going in. Like I said, I don't know much about the surgery, but they're going in. And if the nerve sparing and getting back your erectile functions is important to you, make sure you add that. I want the nerve sparing. I want the radical prostatectomy with nerve sparing. Because that is one of the things where they will tell you that it's implied, but no, won't have time for that. Won't have time to imply that because everything that's written out says radical prostatectomy. No, you make sure that they add the nerve sparing piece into that. Now, one of the things in the surgeries and the reasons that you could have some confusion is because you could have a conversation with someone that had a prostatectomy and you had a radical prostatectomy, and the surgeries themselves, I think there are three ways you could do it: open or laparoscopically, or you could do it robotically. So I think you can do all of them the same way. And so you could have a conversation, and you could have a conversation about how you actually had the surgery, and it could line up. But one of you may have the prostate still in your body, and the other one may have had it fully removed. Now, I say all of that because I would like for you all to go research that and make sure that you are asking for the right thing. That is very important. Secondarily, make sure that you know how many times your doctor has done whatever procedure that you are requesting. You are not a test dummy. You are not somebody that is going in and this person has not done it a lot. And all of a sudden they're like, no, we can do it. Don't do it. my doctor was able to tell me exactly how many he had done, down to the number. Then I asked a follow-up question. The percentage of people who had had the radical prostatectomy with nerve sparing, who actually retained their, or came back to him and retained their erectile functions. And I didn't expect him to know that. But my doctor did. So now I'm asking you to hold your doctor accountable for having that information. Hey, listen, are you doing the nerve sparing? Because my initial doctor said that he could do the radical prostatectomy, but he told me that he couldn't do the nerve sparing, as well as the doctor that he sent me to. Amazing, amazing. It still gives me chills that one doctor actually told me he wasn't as good. And I'm telling you all, you'd have to find somebody that actually had that sense of themselves and would actually share it with you. But imagine how many times that doesn't occur. That maybe they're not very good at that. Or maybe they told you they could spare the nerve and that was the first time that they've tried it. You need to make sure that you're asking questions. You need to make sure that you understand who your doctor is in that world with that type of surgery. And if they're not the guy or the woman or the person who is really good at that, you might want to find somebody else if your insurance allows. Now, I've said all of this on numerous occasions and numerous videos, but your recovery and your procedure and your process, I believe, depends on the hands of your doctor and just how good they are. And like anything, however many times they've done it, I'm sure they get better over time. So keep that in mind. Do not skimp on your care. Make sure you ask the questions. Make sure you go in there and say, I want the prostatectomy, I want the radical prostatectomy, or you want the radical prostatectomy with nerve sparing. Whatever one you decide that you want, you make sure you ask them specifically for that. And that is the conversation that you're having with them. All right? I hope this finds you well. Peace and blessings, fellas.